You've probably heard the phrase no pain, no gain. But when it comes to long-term health and fitness, that's not entirely true. Your body doesn't just grow stronger when you work hard, it grows stronger when you recover well. And that's where active recovery workouts come in. Active recovery means using gentle, low-intensity movement on your rest days to help your body heal, improve circulation, and reduce soreness without completely stopping activity. Taking care of yourself physically, mentally, and emotionally isn't just about pushing harder, it's about finding balance. When you prioritize recovery, you improve performance, prevent injuries, and maintain overall well-being for the long run. Now let's talk about what hurts your recovery and your health in general. Modern lifestyles often push our bodies beyond what they're built to handle. Common risk factors include poor diet. Eating too little or too much of the wrong foods slows healing. Lack of exercise or overtraining, both extremes stress the body. Chronic stress keeps your body in fight or flight mode. Sleep deprivation prevents muscle repair and energy restoration. Smoking or excessive alcohol damages tissues and weakens recovery. Ignoring rest, training non-stop without downtime leads to burnout. These habits gradually wear you down, lowering energy levels and weakening the immune system. When recovery and self-care are neglected, it's not just your workouts that suffer, your whole body does. Over time, the following conditions can develop: heart disease and hypertension from chronic stress and lack of rest, type 2 diabetes and obesity from inactivity and poor nutrition, hormonal imbalances and fatigue from overtraining, joint pain or injuries from lack of mobility work, depression, anxiety, and burnout from constant physical and mental strain. Even dedicated athletes can experience these issues when they don't allow their bodies enough recovery time. Your body often tells you when it's overworked or under-recovered. Here are some red flags to look for: constant muscle soreness or stiffness, fatigue that doesn't go away even after sleep, decreased performance or slower progress, irritability or mood swings, trouble sleeping or restlessness, frequent illness or injuries, loss of motivation. If any of these sound familiar, your body might be asking for an active recovery day. So, how do you bounce back and support recovery the right way? It starts with movement, but the right kind of movement. Active recovery workouts are low-intensity activities that keep your blood flowing without adding more stress. These could include walking or light jogging, swimming or water aerobics, cycling at an easy pace, yoga or stretching sessions, foam rolling or mobility drills, recreational sports done at a relaxed pace. These gentle exercises help reduce lactic acid buildup, improve flexibility, and speed up recovery, all while keeping your mind active and engaged. Also, support your recovery by eating balanced, nutrient-rich meals, staying hydrated throughout the day, sleeping 7 to 9 hours each night, managing stress through deep breathing or meditation, scheduling regular massage or physical therapy sessions when needed. The best approach to long-term health is consistency, not perfection. Here's a simple self-care plan to integrate into your weekly routine. Train 3 to 5 times per week with a mix of strength and cardio. Add 1-2 active recovery days, like yoga, stretching, or a light walk. Eat whole foods, lean proteins, complex carbs, and healthy fats. Drink water consistently, not just during workouts. Prioritize sleep. Aim for a bedtime routine that supports rest. Manage stress. Try journaling, nature walks, or unplugging from screens. Listen to your body. Fatigue, pain, or irritability mean you might need to slow down. Small, consistent habits today prevent major health problems tomorrow. The concept of active recovery isn't new. Ancient Greek athletes practiced gentle stretching and walking after intense Olympic training sessions to restore vitality. Modern sports science confirms that active recovery improves circulation, reduces inflammation, and accelerates muscle repair. Studies also show it lowers cortisol levels, the stress hormone, and boosts endorphins, which help with mood and mental clarity. In other words, recovery isn't just physical. It's deeply connected to emotional and mental health, too. When you ignore recovery, your body eventually forces you to stop. Overtraining can lead to chronic fatigue syndrome, weakened immune function, persistent injuries, burnout and depression, loss of motivation and focus. Skipping rest doesn't save time. It costs progress. A few light workouts each week can prevent months of forced rest due to injury or exhaustion. So, what are active recovery workouts? They're the bridge between working hard and staying healthy. They're your body's way of saying, "Thank you for giving me what I need to grow." Remember, progress isn't just built in the gym. It's built in how you care for yourself between sessions. When you move with intention, rest with purpose, and listen to your body, you don't just perform better, you live better. Take that walk. Do that stretch. Breathe deeply. Because real strength isn't just about lifting heavy, it's about lasting a lifetime. This information is for educational purposes only and should not replace professional medical advice. Always consult a healthcare or fitness professional before starting or changing your exercise routine.